The title says it all, serene bursitis. I've got my finger right on the point of maximum tenderness in an serene bursitis. A bursitis is just an inflammation of a little sac that normally isn't even a sac. It's normally just a little cushion, and it can fill up with fluid when you have inflammation. As you can see, this is a knee, and we're on the medial side of the knee. See, it's a right foot, so this is the medial side, a little bit down from the joint line being here, and then the pes anserinus, as it's called, is located here. The name comes from pes anserinus, means the foot of the bird, or bird foot. You have these three tendons that go out kind of like this, kind of looking like a bird's foot. And under the skin here, that's what's going on. The hamstring muscles come into a tendon, and then, or three hamstring muscles, three different tendons, and right here is where they attach. And when they get inflamed, oftentimes with physical activity, running for example, a personal example, you'll get a little bit of just soreness right in this area, a little bit below the knee. Actually, people usually think it's right at the knee. And oftentimes when I'm examining patients for serene bursitis, they'll come in with knee pain, and they'll point to the joint line, and then I'll do the exam and I'll push right about here, and I'll get quite a response from them, not because I'm trying to hurt them, but because that's where the is of an serene bursitis. And then we'll go ahead and go over the treatment. The treatment is to modify the activity so you're not aggravating it so much, not so much use of the tendon, running shorter distances or at lower speeds. And then you can, if needed, if it's not getting better just with that, and with stretches, and I'll show you, the stretch would be this here. Let me show you the stretch. You guys probably know the stretch already. Hamstring stretches, kind of hard to show. Put the leg back and straighten it out like this, as leaning forward on the other foot, and you're stretching the hamstring back there. The back of the leg above the knee is getting stretched, and you can feel it coming down behind the knee, and that allows you to get that pes anserinus, or the anserine tendons, stretched out so you don't get such a pain from it. And then over time, if it's not getting better, certain anti-inflammatories can be used. Icing is great for it. Putting the ice on, not direct ice on the skin, but ice pack, and putting that on for 20 minutes at a time. And then if needed, we can give cortisone shots on it. I've done several of those with good success. And if it's not getting better from that, well, then we probably have to talk to an orthopedic surgeon. But that's very, very rare. We've never, maybe, I actually don't remember ever having to have an orthopedic surgeon talk about it. So somebody was asking about vertigo. That's not the title of this particular periscope, but since there's just a few of us here, I can just touch on vertigo. Vertigo is an interesting complaint. People come in complaining of vertigo, dizziness, spinning sensation, and we have to specify, is it truly vertigo? Because these sensations are not things that are talked about enough in non-clinical life for patients to be able to always give you correct description of what's going on. So you have to really get down, is this a sensation of lightheadedness that maybe happens perhaps with standing up, or is this actually true alteration of sensation, and that you have this illusion of movement, and usually it's rotary movement that's going on. And if you can reproduce it in the office, often you'll see nystagmus, where the eye goes like this when you are able to induce it. Vertigo can be caused by both central, meaning brain problems, and peripheral, meaning usually middle ear. The middle ear problems usually are minor and can be things like infections, or just something like a loose piece of the balance organ called an otoconia, or ear rock. And that causes a very benign type of vertigo that just comes on with, say, movement of the head. And they'll get the spinning sensation when they turn their head a certain way. Oftentimes it's turning over in bed that'll trigger it. And we can actually reproduce this in the office with something called the Dix-Hallpike maneuver, where you lay the patient down a certain way with the head at a certain angle, and then you try it in another direction to specify which side is actually causing it. And in the office, you'll see their eyes go like this, and they'll get very uncomfortable. You'll get this look in their eyes of anxiety, and rarely you can actually make the patient throw up, which isn't real desirable. And that is benign paroxysmal positional vertigo. Benign meaning it's not something dangerous. Paroxysmal referring to it comes in paroxysms or episodes and goes away. Positional referring to the position of the head, and vertigo referring to that altered sensation or illusion of movement when they're actually still. It is treated with home exercises called the Epley maneuvers. You can look those up, E-P-L-Y, or is it E-P-L-E-Y? Try both. Google will correct it for you. And there's a number of versions of those that exist, but all of them are pretty much going to do the same thing. And those can be done at home. And then we'll actually have a vestibular therapy through a physical therapy office for people who are having trouble getting relief from it. It can last for weeks. It can last for just days and then go away. And people will learn how to hold their head to not cause that again. So that's the most common form of vertigo. Again, central vertigo that's coming from the central nervous system, which can be a form of seizure, can be from stroke, can be from a mass or a tumor. Cancer type growth. These are things that need to be looked at a little more seriously, and usually are not the suddenly on and then off. They're more gradual. They're usually there for weeks before they come in for it, and it's usually progressive. And that, of course, is most commonly diagnosed on imaging, or if it's seizure activity with EEG through a neurologist. Well, thanks for listening, guys. Not a whole lot of hearts there, so we'll just go ahead and wrap up. If you do want to follow, you just go ahead and swipe right to follow, and that way you can be aware of when we're coming. Oh, thank you for the hearts, by the way. And I hope that was helpful for you. If you guys ever have questions about answering bursitis, causes vertigo. I'm watching the U.S. Open and golfers struggling with it. It's just exactly what I just said. So if you want more information, go ahead and do a search for vertigo online and look for things that are related to benign paroxysmal positional vertigo, and you'll be able to learn quite a bit about it. Mostly what I just described, that otoconia, or that loose rock in the middle ear, and that, again, that's just the benign type. The other causes that we went through earlier are stroke, mass in the brain, or cancer. You can also have it from seizure activity. Okay, and next time we'll have more fun. Until then, this is Dr. Vaughan telling you to stay in good health.